So to reconstitute the tissue factor, you take the DNA grade water out of the little fridge in the Rotem Teg room, and you go to the back freezer room and grab 2 vials of tissue factor reagent. Use a 1,000 microliter pipette set to 200 microliters, which looks like this. See that? And one of the big tips. You press to the first point of resistance on the pipette and pull up. Open one of the bottles of tissue factor and pipette the liquid down the side. You do the same thing for the second bottle. If you think that the tip hit the tissue factor, make sure you eject it and get a new one. Close the water and make sure that there are no bubbles in the tissue factor reagent. You can get rid of bubbles at the bottom by tapping the vials on the table. You then vortex both samples to mix them evenly, write the time and date, and put them in the fridge for a half hour. So once you get blood from the trauma room, you take one of the transfer units and screw it to the top of your syringe. You then fill the tubes in order: scat, citrates, and packs, or white, blue, red. The vacutainers autofill, so you push the syringe into it and it'll fill to a certain line. You want to invert the scat and citrate tubes 3 to 5 times and invert the packs 8 to 10 times. Once that's done, you mark down the time that the blood was taken. You put one of the tubes, if you are running Rotem and Teg, into the incubator and mark that time. If you're not running Rotem and Teg, they'll all go into the centrifuge. You also want to weigh the tubes. So you turn on the scale and wait for it to tear with the little cover on it. Once all of the numbers read 0, you put your tube on, wait for it to stop moving, and then record the weight on the CRF. You also want to make sure you write down the lot number. Once you do this for all the tubes, in order, you make sure that you label them. The 00 label goes on the CRF. So your first tube, or the scat, should be labeled 1. You do this down the line, making sure you keep track of which tube is filled in which order. You then take the scat and citrate tubes and put them in the centrifuge. Program 2 is what you want to run it on. So you hit the open button, and making sure it's balanced, you put everything in. If you're running all the citrate tubes, you want to make sure that they're even across. There's a citrate balance up here in the cabinet. You then close the machine and hit start. Once it's done running, you'll begin to aliquot. It runs for 17 minutes, and you want to write the time that you start the centrifuge.
Perfect. So Chelsea just finished centrifuging the blood, and while that was taking place, the important things that she mentioned was to make sure to write the time that it went to the centrifuge, and if you were blood processing using the Rotem and Teg, you'd also have the incubation time of the other citrate tube. While the blood is spinning down, I like to fill out the general sample information. So the draw number, as Chelsea has mentioned, it would be the 00 of the labels. You find the labels inside this cabinet right here. You have the subject ID, which you can get from the binder in next to the research desk So it'll be the next number, ACIT, this one will be 209, and then LB, which is the initials of the patient. The operator will be your name, the collection date, the collection time, which is important, which blood draw it is. So this was the 0 hour, and it came from an IV line. So we have all our tubes out from the centrifuge. Before they went in, remember we wrote down the lot numbers and their weights. Now we're going to do the quality control score. And that information about the parameters can be found in the manual of operations. It's on page 11, I believe, right here. So it gives you some general information about what the tubes should be. So when that noise comes on, you can also just cancel that, as Chelsea did. So we have our scat tube right here. Its weight, 10.9 grams, which will tell us right here. Scat tube 10.2 to 11.3 is what it should be. So that's good. Next we'll check for hemolysis, which as you can see, we do have some hemolysis, so that knocks it down 1 score. So now 2 out of 3 parameters are good. And as long as it was processed within 15 minutes, which means either the time it was put in the centrifuge or the incubator, and it was within 15 minutes. So the max score it can get there is a 2, because it got 2 out of 3 parameters were okay. And next you can kind of continue that with the citrate tubes, and the only thing different about those are the weights. So maybe double check the weights, and should have went in the centrifuge at the same time. So we'll do one more of those just to check. So we have hemolysis here. We know it went into the centrifuge within 15 minutes, and its weight 10.7 grams is within the standard. That gets a 2. Okay. Okay, so when you're getting close to the cell pellet at the bottom of the tube, it's okay to leave a little bit, leave a little plasma on top. You just want to be careful that you don't rupture the pellet or pull any up, because you're going to have to re-centrifuge the sample. So that's an acceptable amount to leave. And as you practice and you get closer, you get more of a feel for it. You'll tell how close you can get, and you can kind of see the pellet move a little bit, so you don't want to go much further than that. The last thing I want to show you on the CRF right here is what it will look like when you're finished. We haven't done all the citrate tubes, but this sheet will be filled out as I've explained, with the Aliquot number over here, which comes from the label. You have your tube type, your lot number, which was taken earlier, the weights, Q scores, hemolysis, and then as you fill out your cryo vials, you want to write down what source tube it came from, and then it'll go like that. And then the last part of this, we're going to go back and put them in the freezer.
Alright, so when you're filling out a box diagram, it's important to make sure that the person before you did it correctly. So we're going to backtrack, and I've taken out the plasma aliquots just so you can see what you would do from the beginning. So you look at the number, and the last draw to be done was 468, and the last tube in that series was 06. So it does end at the appropriate spot in the box, but just to be sure, we'll look at the label, and it does match. So now I'm ready to put my samples in. I want to make sure they go in order. So we have 0483, number 8, which is our first plasma aliquot, and that goes there. I would then write that number here and continue down sequentially, just as I did filling the boxes previously.